Hi everyone, get ready for expert tips, practice questions, and clear explanations, all designed to make your NCLEX journey smooth and stress-free. Subscribe now and let's make NCLEX success easy together. Question 31. A nurse is reviewing lab results. Which set of values should be reported immediately? A. Sodium 138, potassium 4.2, calcium 9.4b, sodium 130, potassium 5.0, Magnesium 2.0 degrees Celsius. Sodium 125, potassium 3.2, calcium 7.0 degrees Celsius. Sodium 136, potassium 4.0, magnesium 1.8. Correct answer C. Sodium 125, potassium 3.2, calcium 7.0. Rationale: all three values in option C are outside normal range. Hyponatremia, Na plus 125, hypokalemia, K plus 3.2, and hypokalcemia, Ca plus 7.0, increase risk of neurological and cardiac complications. Strategy. Tip: choose the option with multiple abnormal electrolytes, especially when involving sodium, potassium, or calcium. Question 32. Which fluid is most appropriate for initial treatment of a client with hypovolemic shock? A. 0.9% sodium chloride. B. 0.45% sodium chloride. C. D. 5WD 3% sodium chloride. Correct answer A. 0.9% sodium chloride. Rationale: 0.9% sodium chloride is an isotonic solution that expands intravascular volume, making it ideal for fluid resuscitation in hypovolemic shock. Strategy. Tip: in shock or trauma, always choose isotonic solutions first for rapid fluid replacement. Question 33. A client with Cushing syndrome is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hyperphosphatemia. Correct answer C. Hypokalemia. Rationale: Cushing's causes excess cortisol, which mimics aldosterone and increases sodium retention and potassium loss, resulting in hypokalemia. Strategy. Tip: remember Cushing's equals cortisol excess equals sodium up, potassium down. Question 34. What is the most concerning sign of hypokalemia? A. Abdominal cramps. B. Muscle weakness. C. Weak pulse. D. Irregular heartbeat. Correct answer D. Irregular heartbeat. Rationale: while all are signs of hypokalemia, cardiac dysrhythmias are the most life-threatening and must be addressed immediately. Strategy. Tip: always prioritize airway, breathing, circulation. Irregular heartbeat signals risk of arrhythmias, circulation issue. Question 35. A client receiving magnesium sulfate IV reports feeling flushed and weak. What is the nurse's next action? A. Decrease the infusion rate. B. Continue the infusion. C. Administer a bolus of normal saline. D. Stop the IV immediately and call provider. Correct answer A. Decrease the infusion rate. Rationale: early signs of magnesium toxicity, flushing, weakness, warrant slowing the infusion. Stopping it altogether is unnecessary unless severe symptoms like respiratory depression occur. Strategy. Tip: for mild or moderate adverse drug effects, reducing the dose is often safer than stopping therapy abruptly. Question 36. Which assessment finding indicates hyperphosphatemia? A. Bone pain and fractures. B. Numbness and tingling around the mouth. C. Hypoactive bowel sounds. D. Tachycardia and flushed skin. Correct answer B. Numbness and tingling around the mouth. Rationale: hyperphosphatemia often causes hypocalcemia, inverse relationship, leading to paresthesias and tetany. Strategy. Tip: phosphorus and calcium have an inverse relationship. If phosphorus is high, calcium is likely low. Question 37. The nurse is caring for a client with dehydration. Which lab finding supports this diagnosis? A. Hematocrit 30%. B. Urine specific gravity 1.030 C. Serum sodium 130 milliequivalents per liter. D. Bun, 7 milligrams per deciliter. Correct answer, B. Urine specific gravity, 1.030. Rationale. A urine specific gravity of 1.030 is elevated, indicating concentrated urine, which is a hallmark of dehydration. Strategy. Tip. No normal lab values. Urine specific gravity greater than 1.025 usually means dehydration. Question 38. A nurse is monitoring a client with syndrome of inappropriate antidiuretic hormone, SIADH. What is the expected sodium level? A. 128 milliequivalents per liter. B. 138 milliequivalents per liter. C. 148 milliequivalents per liter. D. 158 milliequivalents per liter. Correct answer, A. 128 milliequivalents per liter. Rationale. SIADH leads to water retention, diluting sodium levels and causing hyponatremia. Sodium levels less than 135 milliequivalents per liter are consistent with the diagnosis. Strategy. Tip. SIADH. Soaked inside. Water retention. Low sodium. Concentrated urine. Question 39. Which food should be included in the diet of a client with hypophosphatemia? A. Bananas. B. Eggs. C. Apple juice. D. White rice. Correct answer, B. Eggs. Rationale. Eggs, milk, and meats are rich in phosphorus and help replenish phosphate levels. Strategy. Tip. Think animal proteins equals phosphate rich. Avoid fruits and refined carbs for phosphate replacement. Question 40. Which finding is a late sign of fluid volume overload? A. Crackles in lungs. B. Dry mucous membranes. C. Tachycardia. D. Flat neck veins. Correct answer. A. Crackles in lungs. Rationale. Crackles indicate pulmonary congestion, a serious and late sign of volume overload. Early signs include weight gain, edema, and jugular vein distension. Strategy. Tip. Look for lung sounds and respiratory distress when determining late-stage fluid overload. If you like this video, please subscribe, like, and share it. Help us make more videos like this.